My patient is post-wrist immobilization at 8 weeks. They are lacking PIP extension, so we are using fluidotherapy to increase tissue extensibility. Fluidotherapy uses convection at about 100 to 118 degrees Fahrenheit to heat the tissue. Little particles of cellulose made from corn cobs float around the chamber. This type of therapy is appropriate because the patient is in the maturation phase of healing and there is no inflammation present. They could benefit from the stretching / active range of motion in the machine while receiving the thermotherapy. Heat plus stretching is shown to have better outcomes than stretching alone via the Lentel et al. Study in 1992. Prior to starting therapy, I would want to gather some general things from the patient's history to assume that fluidotherapy isn't contraindicated. These include any condition of circulatory impairment, hemophilia, acute trauma like active bleeding or inflammation, long-term steroid use, any malignancies, open wounds, which could be a precaution, and then I would put some type of plastic barrier over the wound, fever, age, if they're very young or very old, because they may not be able to describe what they're feeling to me, which is why sensory skin testing of the area and a cognition screen beforehand are both important. Tissues following radiation is another contraindication, and if the patient is taking any anticoagulant medications. Okay, so the temperature is set at 100 to 118 degrees Fahrenheit. We should allow for 5 minutes for the machine to warm up, and then we will have the patient put their arm inside the portal, and then we will tighten the portal to make sure no particles fly out, creating a fall hazard, and then we will press start. With the patient's hand in the machine, we'll be about for 20 minutes, and we'll check on them every 5 minutes or so to ask how they're doing, but we don't need to visually check their skin. And if the machine allowed it, if there were another portal, I could stick my hand inside the other portal before pressing start, and I could help them with assisted range of motion. To the patient, I would say that you'll feel little pieces of sand inside the machine, and you'll also feel heat. But if you feel a burning sensation, I want you to tell me so that we can stop. While you have your hand inside the machine, I want you to be doing what we've been working on, where you're extending your fingers to the point of discomfort, but not to the point of pain. And then we'll do this for about 20 minutes, but I'll keep checking on you periodically. At the end of treatment, I will press the off button. I will untie the portal, brush the cellulose particles off the patient's hand, and I'll once again check the patient's skin like I did prior to treatment to make sure there's nothing wrong with the skin. And then I will ask them how they're feeling and do a range of motion measurement to document in my SOAP note to show an effective treatment session. As a side note, I could also use whirlpool therapy if I wanted my patient to be doing active range of motion while they were receiving the thermotherapy.